Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's Tuesday, July 28th, 2026. The media has spent a lot of time over the last week talking about what has been an increasing epidemic of measles. So what I thought would be a good idea is to go back to the beginning and see where we were and how we got here. So the first measles vaccine in the United States was introduced in 1963. At that time, every year, measles would cause between 3 to 4 million cases. It would cause about 48,000 hospitalizations, primarily from pneumonia, dehydration, and encephalitis, which is inflammation of the brain, and about 500 deaths every year. So the first vaccine was introduced in 1963. The last best vaccine, the one we're using today, the one called the so-called Moreton strain created by Maurice Hilleman, was introduced in 1968. And with that, we had a dramatic reduction in measles in this country. Unfortunately, between 1989 and 1991, there was a sort of an upsurge in measles where there were tens of thousands of hospitalizations. There were more than 100 deaths. And when you looked at that outbreak, virtually all of the children who suffered measles had just never been vaccinated. In any case, what we decided to do in 1989 was to introduce a second dose of measles vaccine, which was really more of a second chance to get a first dose, because the first dose was 93 to 95% effective. By having two doses now, you're at about 97 to 98% effective. Obviously, one of our most effective vaccines. And with that two doses of vaccine, we eliminated measles from the United States in the year 2000. Unfortunately, now it's come roaring back. Last year, in 2025, about 2,300 cases were reported, although the numbers, according to people on the ground, were probably far greater than that, because that was just confirmed cases, people who had been seen and confirmed to have measles, and many people, especially like in the Mennonite community in West Texas, aren't necessarily going to go to the doctor outside of that community. So I think the number was probably at least 2 to 3-fold greater than that. In any case, that was more cases than we'd had in more than 30 years in this country. Plus, we had 2 little children, a healthy 6- and 8-year-old girl, die last year from measles, which was unconscionable given that those deaths were completely preventable. The total number of deaths last year was about 3, which equals the total number of deaths from measles over the last 25 years. And this year, it's even worse. So what's going to happen? I mean, right now it's July. Usually measles is primarily a winter, early spring disease. I think cases now will settle down to some extent, but likely will come roaring back again in November, December. What you'd like to hear from our Secretary of Health and Human Services, Robert F. Kennedy Jr., is a clear, full-throated statement that children need to be vaccinated. Not what he's been saying, which is it's a matter of personal choice. You decide. And then he says, we actually have fewer cases in our country than are currently going on in Canada or Mexico, as if what's going on in this country is in any way acceptable. This is a preventable infection, and we need to prevent it. So what I'm saying is what our Secretary of Health and Human Services should be saying every day, using his famous name and his considerable platform as Secretary of HHS, and say, please vaccinate your children. This is a preventable illness. I think what happened when we eliminated measles in the year 2000 is not only did we eliminate the virus largely, we eliminated the memory of the virus. I think people don't remember how sick or dead measles can make you. So please vaccinate your children. This is a preventable infection. Thank you.